we should just do it.
All right, great. Okay. Welcome to Healing Together from Healthenly. I'm Nicholas Boileau. Today I'm talking to Melanie Rand, a board-certified DO who specializes in family medicine and obesity medicine. In this episode, we cover her outlook on the novel coronavirus and her perspective as not just a doctor, but also a patient. Melanie has an autoimmune disease. We talk about the risks of COVID-19 to patients with autoimmune conditions. We discuss integrative, functional, and holistic medicine, and a whole lot more. So without further delay, here's my conversation with Melanie Rand. So, one of the things I thought I'd just start by asking you, because if people look up your bio or description of you, they'll notice that you're a DO, and I just wanted you to just explain briefly the difference between a DO and an MD.
Sure. So DO stands for Doctor of Osteopathy, which means that I went to an osteopathic medical school, which differs just a little bit from the more traditional type of medical school, which is called allopathic medical school, and that type confers an MD degree. The material covered is all the same, but I think maybe two differences. The difference that people notice most is that osteopathic physicians also learn osteopathic manual medicine, which is hands-on means of treating usually musculoskeletal conditions like back pain and neck pain, but sometimes other things as well. And then maybe the other difference is that a lot of the teaching in osteopathic medical school is related back to some osteopathic principles, sort of there's a philosophy behind it all. And I think that might not be the case with allopathic medical school.
I can tell you that nearly every time I see you, or I can admit that nearly every time I see you, I say, hey, I've got this soreness right here, or this little bump in my back. Could you take a look? And you've been really amazing each time at saying, well, this might be due to your posture, or this might be due to the way you're walking. So you're also a patient. Can you say a little bit about that?
Sure. So I have a chronic condition called rheumatoid arthritis, which is an autoimmune disease.
Is there a difference between disease and condition?
I would say no. I would say that it's all maybe connotations, but definition-wise, I mean the same thing.
And when you have an autoimmune disease, does it affect your whole immune system, or is it focused on a specific area or part of the system?
So parts. I don't know really of any condition or disease that affects the whole immune system. The immune system is so complex and certainly not fully understood yet. And rheumatoid arthritis affects parts of it. And really, rheumatoid arthritis is not fully understood. We really don't know why people get it, and we're just sort of learning what parts of the immune system that it affects.
How is it manifested for you?
I've been lucky in that I was diagnosed pretty early after my symptoms began, and it came under control pretty easily with medications. Before it was well controlled, it was a lot of hand joint pain and hand tendon pain and swelling in those areas. Same with the feet. And then occasional small discomforts in other joints like wrists or elbows. But like I said, the diagnosis came early for me, which meant that we were able to start treatment early before any damage was really done. And I've been lucky that medications do control it well. Typically, most days I barely notice that I have any symptoms of rheumatoid arthritis.
Well, I'm glad. I'll say that today we're recording this. It's March 22nd, and we're what feels like at the beginning of a very steep rise in cases of COVID-19 in the U.S., at least. Everyone's talking about flattening the curve. Are you, given your autoimmune disease, are you looking at COVID-19 differently in terms of your own personal risk?
That's a good question. So I would say that I've had to kind of think that through. And I think that rheumatoid arthritis has ways that it compromises the immune system. And also, some of the medicines that I take have ways that they compromise the immune system. Probably one of the three medicines I take really has that. But I've been on these since 2016 and truly don't get sick more than I did before I had this diagnosis. So I feel like whatever immune compromise that I have personally is probably pretty subtle. I know that this is really variable. Different people with rheumatoid arthritis, some would have much more significant immune compromise related to a lot of different factors, age, what kind of medicines they need to take, what doses of those medicines, what other medical conditions they have, whether they smoke. So just many factors play into it. But I kind of feel like it's unlikely that I'm very significantly immune compromised at this point.
Is it possible your immune system is even more robust because of the work you do and that you're exposed to so many patients?
It's possible. It's a thought, and I really haven't seen studies confirming that. It's just a thought that people have, and certainly there have been a lot of exposures, so that may be the case. Another maybe funny thing about this moment in time, which may change as more information comes through, is this week from just watching the news, I learned that there are a couple of medications already on the market that get used for other things, which are being looked at as possible treatments for COVID-19. Just oddly, one of them is one of the three medicines that I take, hydroxychloroquine. So that's another question that comes up. Does this mean that I have a little bit of protection? We don't know yet, really. I think that's kind of the story, is we just don't know so much about COVID-19 so far.
And I don't think you're telling people to go buy that medicine right now.
Definitely not. Definitely not. We don't know.
Can you think, when it comes to autoimmunities or autoimmune diseases, can you think of ones that might put you at more risk in a case where there's a virus going around like COVID-19?
I think how sick you are from your autoimmune disease would make a big difference in terms of risk. I think that autoimmune diseases are systemic diseases. They affect not only joints or skin, but kind of the whole body, depending on how active the disease is. And I think that someone who is quite debilitated by their disease is probably more immune compromised than someone who's not. I think almost any specific disease that I mentioned, you'll have milder cases and more severe cases, and over the life of any given patient, there'll be times when it's milder and more severe. So I don't really have one in mind.
It's more about how sick you are given your disease.
Yeah.
How about we talk a little bit about just the fact that you've worked with a lot of obese patients, and we have a lot of obesity in the U.S., and I'm just wondering if you can speak to anything in particular that they need to worry about given this epidemic.
Sure. I think that we're just learning that obesity and some of the diseases that often go with it, like high blood pressure and diabetes, are risk factors for more severe disease with COVID-19. And for that reason, people who have those risk factors need to just be extra cautious, in the same way that the elderly are being encouraged to be extra cautious in terms of their physical distancing and hand washing.
And what about you? So I know you don't suffer from obesity, but you have to go to work every day. Many people do, but many others right now don't and are asked not to go to work. And most people don't, they're not likely to face the volume of sick people that you work with. How are you protecting yourself and your family?
So it's interesting. Maine probably had its first case of COVID-19 7 or 8 days ago, something like that. It's changing every day. But really, I think since COVID-19 has been active in the communities where I work, the two healthcare systems that I work for have been so proactive with putting measures in place to protect not only patients, but employees as well, that I've not found myself face to face with very many people with respiratory symptoms. It's been almost a week since I saw a few people with respiratory symptoms. There's a lot of phone triage going on to direct people to appropriate locations. Non-essential appointments are being canceled and rescheduled. Outdoor testing areas are being set up. Designated spaces are being reconfigured into acute respiratory centers and staffed by specific people. So it's just, I don't feel like I am seeing a lot of sick people.
I have a completely different view of this because I've got my brother's an MD in the Bay Area.
Right.
And he's been asked to do shifts where he's in full protective garb. He's sweating like a pig. His glasses are fogging up. And he's in an underground garage where the cars come through.
Oh, my word.
Where he needs to lean into the car, and his back is screaming at this point because he's done it, 10 times already with different patients, and he does it at length, leaning into a car, talking to patients. He's got someone next to him taking notes. He can't take his own notes. And then occasionally asking a patient to exit the car so he can listen to their chest. And he said, the other day he saw 9 patients in a shift, and he wanted to give all of them a COVID-19 test, but due to CDC protocols, he could only give one of them a test, and due to shortage of tests.
Wow.
So it's actually reassuring to me to hear that in Maine, at least, you're not seeing much of it yet. Although you said you've only had one case, or the first case was recorded 7 or 8 days ago, but that's the first confirmed case, right?
Right. And I would say before that, I was seeing people with acute respiratory symptoms, and I wasn't feeling particularly anxious about it at that time.
And we can assume, I think we can all safely assume that when there's a confirmed case, there are probably many unconfirmed cases.
I think so too.
Has your thinking changed since the beginning of, I don't know when COVID-19 really entered your consciousness. For me, it was probably early to mid-January before I even noticed it. And then late January to early February when I started thinking, okay, there's something going on here. How about you, and how's your thinking changed as you've heard more and more? And also, I imagine you're exposed to communication from your health group or your hospital that we're not privy to in the general public.
Yeah, so it's hard to even remember what my thinking was like 2 months ago. I think like you, I was just sort of peripherally aware of this infectious disease surfacing in China, and wondered if anything would become of it. We've seen things surface like this before that haven't really blossomed into a pandemic. So I certainly had not thought much about the flattening the curve concept 2 months ago. And now it seems like that's what we're all thinking about and all working toward.
From my personal perspective, this is really serious. And, if you're not taking measures to socially distance, and if you're not practicing good hygiene, washing your hands, making sure that you're not too close to other people, then you're not only putting yourself at risk, but you're putting a lot of other people at risk. At least that's the attitude I have. How do you feel about it?
I completely agree with you. We should be doing all of this.
And have you noticed your family is cooperative and they're all on board, even if, in my case, I have a son who he says to him it's more of an intellectual idea than a real emotional thing, whereas it hits me really emotionally. But he's doing the behaviors and, adhering to our instructions not to socialize with his friends and not to get too close to people. Do you find that's pretty easy with your kids too?
I find it's pretty easy.
So let's move away from COVID-19 just for a little bit. On Healthily and in the general vernacular, we talk a lot about health and well-being. I'm just wondering if you have any thoughts about those terms and how they might be different for you, or how they're different from each other in your mind.
Health and well-being. I guess we often think of health as being largely physical, but we know that it's a lot more than that. It's mental health, emotional health, spiritual health. And I think having a sense of well-being is an important part of health. They're extremely interrelated, and maybe well-being fits under the umbrella of health as an important piece of it.
And what does well-being mean? What does that mean to you?
Partly it's an attitude. It's a general sense of feeling well or having confidence that you are well.
Are there practices people do that are specific to well-being versus health?
That's a good question. Maybe some meditation practices might be aimed at specifically tapping into a sense of well-being and building a sense of well-being. But even that improves health as well.
You know, let me comment on that too, and tell me what you think. I feel like the Western culture, and particularly our consumer culture, wants us to think about health as an all-encompassing term, and a term that specifically can be addressed by either buying the right thing or taking the right pill.
Right.
And there's a sense that I think recently has been more questioned, because we're noticing that the pills don't really solve every problem. But I have a sense that especially corporate America would like you to believe that you can be healthy if you just buy the thing that makes you happy or take the pill that gives you health.
Right. So that's just not the case, right?
It doesn't feel like the case to me. And then what it does feel like is that we've kind of educated a generation of people to depend on pills and believe in pills, and maybe avoid or just not know about some of the practices that are most important to well-being, if you think of well-being as you described it, as a whole health sort of thing, a whole being sort of thing.
Yeah, I think it's so hard to make generalizations, because my work is treating individuals, right? I look at studies and information that might look at large groups of people, but ultimately I'm one-on-one trying to help an individual sort out what's the right angle for them. And it can be so variable, so unique and different for each person. I wouldn't want to suggest even, there's not a single right path. Nutrition is important, exercise is important, some kind of stress modification can be important, but for any given individual, sometimes it might even be a pill, right?
Yeah, absolutely. And I'm not trying to minimize the importance of pills, but maybe trying to put them in perspective, that they're one, like you say, like I think what you're saying is the pills are one among many tools we have to address health and well-being issues.
Yeah, right. Which group of tools is best for any individual can be so variable. But you wouldn't want to ignore any possibility. You got to think through all of the tools.
Yeah, the thing about pills, though, is that they're so easy and so accessible.
True.
And that's a little bit frightening, because a lot of other techniques for feeling better and functioning better in your life, frankly, they're a lot more difficult to implement than taking a pill.
That's true. The pills are easy.
They're easy. So, but, in that vein, so talking about pills and the way I think our common consciousness has started to wonder about pills as the only tool in the tool chest, we have a lot of new medicines coming online now, or new terms about medicine. And a couple I want to bring up are integrative medicine and holistic medicine and functional medicine. And you already talked about allopathic, which is, I think, our traditional Western medicine. Do you have can you give us any perspective on those other words, integrative medicine and functional medicine and holistic medicine?
Well, that term holistic, I think of as a term that generally recognizes overall health as being more than just physical health, but other aspects of a person as well, mental health, emotional health, spiritual health. So I think holistic would suggest taking in consideration all those different parts and a respect for the idea that for a person to be truly well, all of those pieces have to be in balance. Functional and integrative medicine, I think of as specific schools of medicine or programs, even certifications that you could get as a physician. And to me, integrative medicine, I'm not a specialist in either of these, so hopefully I don't say it incorrectly, but integrative medicine would be a holistic approach. So it would focus on mind, body, spirit, all the parts, and it would be open to various complementary types of treatments. Examples might be nutrition, yoga, acupuncture, biofeedback, stress management, exercise. And I don't 100% know whether integrative practitioners use pharmaceuticals as well, but I would think that they would where appropriate. The other one you mentioned was functional medicine, and I think it's quite similar, but probably a little bit different. Also a holistic approach, but with perhaps more focus on finding the underlying cause of the disease or problem and maybe diving deep into the science, the biochemistry, genetic factors, environmental factors to try to find an underlying cause of some sort, and then using treatments appropriate to address in that way. That's kind of how I think of it.
And what you're saying is that in terms of functional and integrative medicine, those are certifications that you can get or,
Yes.
look for in your provider?
Correct.
I want to address one more thing that we've talked a lot about at Healthenly, and one of the reasons for the site and the platform existing is our belief that, I think it was the Surgeon General under Obama who said we're facing a crisis of loneliness in our country and isolation. And he talked a lot about, I think, especially people who are aging and who are alone. We've got both geographic distance between people, and then we have also a lot of distance in terms of the roles we perform in our culture and in our society. And we also put away people when we're done with them. I mean, I know there's some wonderful and healthy and beautiful places to go after you retire and if you want to be among seniors, but sometimes to me there's something very unhealthy about just the whole concept, or maybe it's counterintuitive, not unhealthy. And one of the things we're believing and that we've seen anecdotally is that people tend to be healthier, and that's barring some, that they don't have some underlying condition that I'm not addressing here. But in general, there's a healthiness when you can get out of your own head, out of your own life, and engage with others and even help others. And we think of it as healing by helping. When you're called to aid a neighbor, you're suddenly not so worried about whatever you were fixing in your house. Your neighbor's house is flooding and you go help bail out water. You're no longer thinking about your leaky faucet. You've sort of forgotten about yourself and your problems. And to us, there's a therapeutic element to that. And
right.
Again, that's not a scientific thing, but I was wondering what you've seen in that regard and what you could comment on in terms of people helping each other in a way as a healing exercise.
That makes a lot of intuitive sense to me. I don't know if I have examples. I don't know if I've focused a lot on that piece in my work for people, but I do think that kind of social engagement wards off depression and leads to a more satisfying life, that one would feel more more healthy or have a greater sense of well-being.
Have you ever noticed, even on a personal level, any of the older people in your life light up more when they're engaged with something or someone versus when they're not?
I might not have specific examples. I think I just agree with you that I see that.
Okay, I've got a few questions. I thought we'd do like a little rapid fire session and just quick responses if you've got them to just a few questions I have. Do you still have time for that?
I do.
Okay. Given COVID-19, what are the top 3 things people can do to protect themselves?
6 feet of distance between you and other people, hand wash, stress management.
What's the top bit of misinformation or bits of misinformation you've seen out in the world or coming at you from patients?
You know, I'm not really seeing trends that way, perhaps because I'm suddenly hardly seeing patients.
And why are you seeing so few patients?
Because most of the appointments have been canceled.
Is that to make room for patients who might come in with infections?
It's to make room and to support people social distancing, not bringing people to the office. I'm doing a lot of phone call treatment and calling people, and it's just the occasional patient who it really makes sense to bring them to the doctor's office.
What are your top sources of information you depend on?
I'm looking at CDC, World Health Organization, Johns Hopkins website.
I look at the same ones. What keeps you up at night?
I'm a pretty good sleeper.
And what are your top habits that keep you sane and healthy?
Sunshine. We're lucky that we have it this month. Walking almost every day. Playing board games with my family. Laughing before bed. I'm currently watching a funny show called Schitt's Creek. That's it.
Very, very similar in my household. Thank you for taking the time to speak with me, and look forward to doing it again.
You're welcome.
Healing Together is produced by Healthenly. Our theme song is Ramble, composed and performed by Ed Morneau.